the foot, there are nerves called the common digital nerve. The digital is the toe. Okay, in the hand it's the finger, but in the foot it's the toe. The common digital nerve travels in the arch of the foot and travels to the toes. That nerve can get pinched between the two metatarsal heads, that's in your foot, not your hand. This area is subject to getting pinched because of our cool, stylish shoes that tend to bring our toes together like this, which is not a great idea. The symptoms that someone will have for Morton's neuroma or interdigital nerve compression is usually the sensation you're walking on a marble. It's pretty uncomfortable. It's an intense, localized pain, not to the bone. It's in the soft spot between the two bones. And you may even get shocks that go up into the tips of your toes. We have two potential surgical options. One is to decompress the nerve. If the nerve is pinched, as a peripheral nerve surgeon, our goal is to unpinch it. If the nerve is relatively healthy, you can often get away with an incision on the top of the foot to release what's called the intermetatarsal ligament. We divide that, and that allows the two toe bones to spread apart a little bit. And as that spreads apart a little bit, the nerve that's underneath that ligament is decompressed. So the second approach from a peripheral nerve surgeon's approach is to simply remove the nerve. We can get away with removing the common digital nerve in your foot because it only goes to one web space. Typically, the most common web spaces are the third and fourth, between the third and fourth toe, and the second and third toe, though they do exist in other web spaces. It's very important to know what you do with the top of that nerve, the front end of that nerve, the proximal part of that nerve. Not all surgeons treat that the same. We treat that by pushing it into the arch of the foot, up into the muscles of the foot, to try to prevent the stump neuroma. We would expect that if we're able to determine if the nerve is healthy enough to save, we should have about an 80 to 85% chance of making that pain, that ice pick pain, that terrible burning, numbness, tingling in the toe, and that ice pick go away. If the block works when we remove the nerve, again, we should have about an 85% chance of making that pain go away. The first is you have to have good blood flow to your foot. So if you do not have good blood flow to your foot, you shouldn't have an operation. Now your surgeon should be the one to tell you if you have adequate blood flow. They need to check your pulses to make sure that is perfectly fine, because if they're not fine, one of the major complications is wound healing complications. Complication that most people fear is what's called a stump neuroma, and that's when the nerve has been cut. The end of the nerve is going to try to regrow, which is why it's so important where the doctor puts the nerve. You would like to have the physician tell you that they're going to tuck the nerve in into the arch of your foot and put it specifically into the muscles of the sole of your foot. You're trying to cap the end of a live wire so that does not no longer electrocute you, and we put that high up in the arch off of the weight-bearing surface. That way you actually can stand on your foot and not right on the stump neuroma. And those procedures are about 80 to 85% successful for those stump neuroma procedures.